It's a hello, good afternoon to COVID scientists and warriors. A warm welcome to all the speakers and participants. I am Dr. Subhash Shira, moderator of the webinar learning series that is launched by the Global COVID-19 Network. As COVID scientists and warriors are drowning in tons of information through publications and social media, the scientific webinars are becoming more credible sources of reliable information. Sambodhi Research and Communication Organization, Indian Social Responsibility Network, New Delhi, and the University of Washington, Seattle have co-sponsored this global network to foster South and South collaboration and partnership to share lessons of COVID. As of 26 May 2020, that's today, the cumulative world case count of COVID has recorded over 5.5 million people infected, and just over 350,000 have lost their lives, thus giving us a fatality rate of 6.5%. I will be very brief to recap the fourth webinar that was held last week on the 19th of May. The clinical diseases they were described that were caused due to COVID, and it occurred in about 15 to 20% of infected persons in different countries, and occur in three stages. Primarily the viral responses in terms of fevers and sneezing and cough, the lung stage, which leads to breathlessness and a low oxygenation of blood, and the storm in the vital organs of the body that cause shutdown of the vital organs at time and cause a lot of clotting. Dr. Prashant Saxena of MaxSmart, Saket, he discussed the effectiveness of the various approved treatments and drugs being currently utilized in the treatment of patients. No cases of relapse or reinfection were reported from India so far. Dr. Debashish Gupta of Sri Chitra Medical Institute was the first one to introduce convalescent plasma therapy in the state of Kerala. He saw positive initial responses in using convalescent plasma therapy in treating 4 patients with severe cases of severe disease of COVID. And finally, Dr. Marcus Jr., he shared a realistic timeline of 12 to 18 months for COVID vaccines, but he had several concerns pertaining to the effectiveness of vaccines. He spoke about the importance of studying the correlates of immunity, and that would obviously take time. Today's webinar is titled Personal and Institutional Prevention and Protection Against COVID. I wish to explain this slide that shows use of facial mask. The mask sounds fairly simple, but it requires common sense for its effective use. Let's look at the bottom of this slide, wherein you find a person at home is safe from COVID infection even when the community around is infected and outside they don't wear a mask. A little above, you will find that the community wearing mask properly that covers the nose as well as the mouth and keeps distance of 6 feet away from other individuals, which is called the physical distancing, will have likelihood of low infection transmission of 2 to 3%. As we go up, we see that as the community people do not put on mask and are not maintaining the physical distancing, the transmission rate of COVID can become very high, say up to 33%, even when the infected persons may or may not be wearing a mask. To sum up this slide, it provides 6 different scenarios of a simple use of mask where the individuals versus the infected people in the communities might be wearing the masks differently, alternatively, and that would reduce or increase the chance of transmission. Moreover, you don't need to wear a medical mask. Instead, a cotton mask made at home can be a good protection when it is used properly. So it's not just to say that everybody is advised to use a mask, because how we use it is with a common sense. At the same time, how we make sure that both the one who is infected and the rest of the community protect themselves. So we move on with this. The first speaker is Dr. Daniel Dionisio, an infectious disease expert from Italy.
Greetings to you all, and thanks for inviting me. Italy was the first European country to halt all traffic with China by plane and declare a state of emergency on January 31st, while even putting scanners in airports to check arrivals, since we are now aware that the virus had been circulating in Italy since early January, if not before. Doctors dealing with pneumonia in January and until mid-February were unaware it was the coronavirus, since the symptoms were so similar to influenza, and the coronavirus was still believed to be largely confined to China. Even after Italy documented its February 21st cluster cases, the unusual way COVID-19 could present itself was understood, with some patients rapidly declining to breathing insufficiency. This comes as no surprise, since Italy was the first European country facing the explosion of the COVID-19 crisis. In this context, it was the first country in Europe to impose restrictions when coronavirus cases began to surface in its northern regions in February. By the beginning of March, the virus had spread to all regions of Italy, though with lesser extent and intensity in central and southern regions than in northern ones. Italy has anyway provided global policymakers with good practices to follow. In this regard, as reported in newspaper Forbes on April 14th, 6 good practices can be highlighted in Italy's response to the coronavirus. As per authors' terms, these practices would include: 1. Prioritize citizens' health and well-being. This point concerns the priority given by the Italian government and Italian institutions to citizens' health and well-being. 2. Emphasize transparent communication. Italian leading figures have preferred to convey clear messages about the extreme seriousness of the situation. In this context, Italian institutions have also done extra work to control and neutralize the spread of false information, which can so easily run throughout social media. 3. Focus on flexibility and taking an integrated approach, meaning that organizations that generally work in sector and contexts that are very distant from each other have integrated their operational capabilities to deliver important tools and machines to fight against COVID-19. For example, Italian CR Engineering International Group, one of the 4 companies in the world producing lung ventilators, has integrated into its organization a team of military engineers in order to guarantee 24-hour production. There are several other similar examples in the country, including the operational integration between the Italian Civil Protection Department and local volunteers associations, in the case of small factories producing protection masks and police force distributing them, among others. Another example worth mentioning is the Italian fashion sector. Companies like Valentino, Calzedonia, Geox, and Prada have quickly moved to the production of masks and other material useful to health sanitary professionals and the population at large. It is interesting to note that the Italian reaction has been neither top-down nor bottom-up. It has instead proved to be an effort of spontaneous, reciprocal collaboration between actors of any kind at any level who are willing to cooperate in new innovative ways.
Hello, everyone. My name is Leena Inamdar. As Dr. Hira mentioned, I'm a public health physician currently working in global health for health system strengthening in low and middle income countries, and currently working on a international health strengthening regulations program at Public Health England. My talk represents my personal views based on international evidence and not of my organization. I've been invited to talk on personal and institutional prevention and protection measures. So at the outset, I would like to highlight that different countries are currently in different phases of the pandemic response. So everyone should follow their own country national current guidelines. What I will aim to do in my presentation is to cover the main principles in terms of prevention and protection measures, but each country has developed its own guidance based on how the epidemic is progressing in their country, its population and system. So it's necessary we follow our own national guidance. I just wanted to highlight at the moment with this slide how the world, we are all currently facing a battle against the unknown and invisible enemy. And this enemy does not respect any border or hierarchy. And unfortunately, it has exposed tremendous fragilities in our systems, whether we're talking of developing countries or developed countries. So since a large proportion of the audience is from Global South, just to highlight key issues which are common to the Global South during the COVID-19 response. Now, first wave of the COVID-19 pandemic, it may be receding in some parts of Western Europe, East Asia, or North America, but it is rapidly taking off in Latin America, Africa, and South Asia. And some of the countries in these low middle income country regions are experiencing spiraling infections, hospitalizations, and deaths. Owing to a lack of testing, it is likely that the numbers may be quite an underrepresentation of the true numbers. And the impact of COVID-19 doesn't just depend on the national preparedness, but it also depends on the state of readiness of our states and municipal corporations as well. Now, what cities like in Brazil, in Nigeria, and in India do next will not only determine the health of their residents, but in fact, it will also impact the fate of their national economies in future. And whether rich or poor, all cities are facing similar challenges as COVID-19 spreads, especially the way it impacts our underserviced populations. Many cities have experienced shortfalls in testing kits, in protective gears and medical equipments. Hospitals, clinics, ICUs are limited. So cities in these developing countries really have a triple burden, and that includes low health capacity, stark socioeconomic disparities, and also high population density that make the physical distancing measures, the shelters in place, almost virtually impossible, quite challenging to adhere to and to enforce as well.
Hello everyone, I'm Dr. Shivangi. I'm a consulting homeopath, and in this video, I'll be discussing homeopathy's efficacy in treatment and prevention of coronavirus. If we look back into history, homeopathy has a very good track record with treating epidemics and infectious diseases worldwide. The use of homeoprophylaxis right from the time of Dr. Samuel Hahnemann in 1798 to the present day is widely evidenced throughout the homeopathic literature. Homeopathy has successfully reduced the mortality rate in several recorded incidents of epidemics, be it scarlet fever of 1799, typhus fever, epidemic of cholera, yellow fever, diphtheria, and most relevant to our present circumstances, the success of homeopathy in treating the Spanish flu of 1918. Also, not to forget the massive and highly successful homeoprophylaxis intervention in Cuba for leptospirosis in 2007. So the epidemiological evidence clearly shows that homeopathy discloses a very consistent and strong prophylactic and therapeutic effect, while at the same time it offers safe, cost-effective, and clinically viable alternatives to conventional medicine for prevention and treatment of patients with infectious diseases. Homeoprophylaxis intends to instill a natural immunity by stimulating the inherent immune system so that when we are exposed to the disease, our vital force is primed to react with a mild or asymptomatic version of that disease. Many homeopathic practitioners who have successfully treated coronavirus cases claim that the patients who have been either exclusively treated with homeopathy or alongside conventional therapy recovered faster, used fewer medications, and had a better prognosis. However, different homeopathic remedies might be needed in different symptomatology. Now, moving on to why homeopathy is proving to be so effective when it comes to treating this epidemic. Unlike bacteria, viruses depend upon the living cells to survive and replicate. They also mutate very quickly, resulting in the viral pandemics which are difficult to manage, like this one. When we encounter a viral infection, our body's immune defense system intervenes with its innate response. In many cases, this initial response, this initial activity of the immune system, is sufficient to kill the virus. Even in coronavirus infection, it's seen that a robust immune response across different cell types is associated with quick clinical recovery, similar to what we see in influenza. So far, the majority of COVID-19 cases, that's around 80% approx, are mild cases, mild to moderate cases. And most of these patients with mild infection do not progress into severe form and can recover with just the help of their own immune system. Now, remaining 18 to 20% who are at the higher risk of developing severe complications and death are elderly people, or those who are predominantly affected by an underlying chronic medical condition. They are the ones who have a compromised immunity. Even an overactive immune response is thought to play a role in disease progression of the sickest COVID-19 patients. So, in order to recover, it is vital that we have a healthy immune system that provides the body with modalities to fight back when it is under attack. And in order to promote a healthy immune system and optimum immune system, we can definitely rely on homeopathy. Homeopathic medicines have been shown to significantly lower the risk of developing infections when we use them prophylactically before viral exposures. So they have been found to be effective in numerous public health situations treating a range of infectious diseases. Homeopathy is a system of medicine which has proved its efficacy in treating epidemics without damaging the immune system. So by adding homeopathy as adjunct to conventional medicine, patients, clinicians, society as a whole, and even conventional medicine has nothing to lose. But on the contrary, they have everything to gain if we obtain the same success as the ones that have already been obtained in the past. Thank you.